This podcast is all about osmosis and dialysis. And I know what you're thinking. I've heard this before. I've seen this before. So we're going to re-engage that content from, middle school or high school. And then we're going to look at it more from a nursing perspective. Let's start with what a semi-permeable membrane is. Semi-permeable membrane is exactly what it sounds like. It's permeable to some particles and not to others. So small solutes in water are able to pass through, but not larger molecules. So ions can pass through, glucose can pass through, water can pass through. Larger, more complex molecules cannot pass through. When we talk about osmosis, we're really talking about the movement of water. So keep that in mind. We're talking specifically for osmosis, the movement of water. And water is going to move from an area of low concentration to an area of high concentration. And when we have just water moving and no movement of solutes, the whole purpose of this moving from low to high is so that water can dilute the concentration of your solute. So looking at the image that we have here, we have a semi-permeable membrane. So whatever these solute molecules are, they are big enough that they will not pass through the semi-permeable membrane. So we have pure water on the right-hand side, and we have some solute particles on the left-hand side. So water will move in both directions. That's something to keep in mind. Water is going to move to the left and to the right. It never stops moving across that membrane, but it's going to flow at a higher rate from the left, where you have a low concentration of solute, to the right, where you have a high concentration of solutes. And if you look at the water level here, we've actually increased the water level in an attempt to dilute the concentration of that solute. And water will stop moving either when both sides have an equal concentration, or we've reached the max osmotic pressure. So at some point you can't keep pushing water across that membrane. It's reached its maximum. Let's talk about osmotic pressure. All right, this is a pressure that prevents the flow of additional solvent into a solution on one side of a semi-permeable membrane. Okay, so in our picture, we see one of these horseshoe-shaped apparatus, and right in the center, boom, right here is your semi-permeable membrane. So it's pure water. We have equal water amounts on both sides of the semi-permeable membrane. If we were to add solute to the right-hand side of this U-shaped apparatus, we would see a net movement of water from the left-hand side, where there's pure water, to the right-hand side. The goal, again, is to dilute the higher concentration. So water will move from a side of low concentration, or in this case, no concentration, to a side of higher concentration. And look what it does to the water level. Okay, so it increases the water level on that side. It will continue to increase that until you reach that maximum amount of osmotic pressure. Okay, now it can't do anything else. If we were to apply pressure on one side, that would cause the other side to raise. Okay, so pushing down on one side would cause the other side to raise, and a negative pressure would have the opposite effect. If we have a negative pressure on one side, it causes that side to raise and the other side to lower. Okay. So I do also like this diagram. The osmotic pressure is the difference in sides. So think about that as being the difference in the pressure experienced on either side of that U-shaped membrane. And osmotic pressure does depend on the number of particles in a solution. This is considered a colligative property. We will get to colligative properties very soon, 2 more podcasts, and we can talk about what that means. We'll leave it for a podcast. So the greater number of dissolved particles, the greater the osmotic pressure is going to be. So if you really stack one side full, you're going to increase, full of solute particles, you're going to really increase the osmotic pressure on that side. So we're going to go through the types of solutions, which are isotonic, hypotonic, and hypertonic. Words I'm sure that you've interacted with before, but we're going to re-engage that previous knowledge. So iso means the same or equal. So we have equal flow of water. One thing to keep in mind is when you have a cell that's placed into an isotonic solution, it doesn't mean that you have no flow of water. It just means that water is going into the cell at the same rate that it's coming out of the cell. You have equal flow of water and equal osmotic pressure on both sides. So these little green dots are representing our solute, and we have 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6. Okay, good. Equal numbers of solute on either side. This is the membrane. So we're going to have equal water flow in and out of this solution. So bringing this back to healthcare, if we think about our cells being in an isotonic solution, and that doesn't mean that there's no solute present at all. It just means that whatever's inside the cell, the solute concentration is equal to the solute concentration outside of the cell. This is what our red blood cells are happiest in. They want to be in an isotonic solution. When they are, they take on that characteristic red blood cell shape where they look like a little piece of Play-Doh with a pressed in thumb. That has the highest surface area. It's able to capture oxygen and carry oxygen the most efficiently. It flows well through your veins. It is a good place to be for a red blood cell. When we talk about hyper over or hypo under solution, we're talking about the solution outside of the cell. So think about what does outside of the cell look like. So hyper means over. Think about, your kids that are hyperactive, they're overactive. The solution outside of the cell is more concentrated. So looking at our image here, we have way more solute particles outside of the cell. If water is the only thing that can pass through that membrane, water is going to move from low concentration to high concentration at a greater rate than it's moving back into the cell. And again, the goal being we're going to move enough water out of the cell so that the concentration outside of the cell is equal to the concentration inside the cell. And we can do this by diluting the outside concentration with water. Well, what happens when you do that? It sounds good and dandy, except for that you are moving water out of the cell. So in the case of red blood cells, if you were to place them in a salt solution, water is going to move out of those red blood cells, and it's going to start to shrink and shrivel up. It's going to lose the water that's inside. We call this process crenation, and that is a term that you should know. It's something that happens to our red blood cells when they're in a hypertonic solution and they start to kind of shrivel up. And notice the change in shape for these red blood cells. They're not going to work as well in the shape, and they're going to have a higher chance of getting stuck on your blood vessels, on each other. And now we're talking about some serious health issues, most likely from dehydration. Our final type of solution is a hypotonic, and hypo means under or below. So in this case, your solution outside of the cell is less concentrated than the solution inside. So notice our image again. We have one solute particle outside the cell and a bunch inside the cell. Remember that water moves from low concentration to high concentration. So in this case, water is going to move into the cell at a faster rate than it moves out of the cell. So what's going to happen is water is going to flow inside, trying to dilute the higher concentration inside, and it's going to cause the cell to expand because it's trying to dilute the inner concentration until both sides have equal concentration. Your red blood cell can take some of this happening. It's going to start to kind of balloon up and swell, and at some point though, if it keeps taking on water, it's going to burst. Think of it being like a balloon that you overfill with air. We call this hemolysis. Lysis is to split or burst. Ugh, there's one bursting right there. Also, not a great place to be. So if you have a patient who is drinking distilled water, which has no ions in it, no solute concentration, they're putting themselves at risk for having hemolysis of their blood cells because they are putting in water that has a lower concentration of solutes than their cells. Yikes. Would just like to compare these side by side. We talked about red blood cells and the flow of water. So in a hypertonic situation, you have more water flowing out. If we were to look at a plant cell, which is what you're seeing on the bottom here, we have the exact same situation. In a plant cell, if you are losing more water to the outside, your plant cell membrane is going to start to come off the walls of the cell wall, which is that outer rigid structural membrane. It's not really a membrane, it's a structure. Your large central vacuole is decreasing. This is when your plant starts to look like it's wilting. Okay. When you have equal flow in and out, your cell membrane is able to press against the cell walls. That helps to hold the shape of the plant. Think of that in isotonic solution as being a healthy place for your plant. And then if you have water flowing into a plant cell faster than it's flowing out, it can take on a lot more because it has that structural boundary that our blood cells do not. So it can actually become engorged. We call that turgid. All right, dialysis is similar to osmosis, but in this case, instead of just talking about the flow of water across a semipermeable membrane, we're talking about small molecules, water, urea, ions. We're talking about those passing through a membrane, so not just the flow of water anymore. And if you were able to attend school in person or you had any lab experiences in biology, you most likely have done this experiment in the classroom previously. But we start with a tube. This is called dialysis tubing, so it's a semipermeable membrane. And we fill the inside of the tube with a concentrated solution. It can have small ions. I don't know what the identity of this is. Put it into pure water, into a solvent, and you'll see over time that you have a movement of your solute, from an area of high concentration to low. So those red particles are small enough to pass through the membrane, and they're going to move out of the membrane until it's equal concentration on both sides of that membrane. Whatever those blue molecules are, those are representing larger molecules that can't pass through the membrane, so they're stuck inside the bag. And then we'd be able to test for the presence of the solute in the solution outside of the bag as well as inside of the bag. All right, so why does this matter for a nursing major? Let me tell you. If you have patients who are in renal failure, so their kidneys are not functioning properly or they're having trouble ridding their bodies of waste, you're going to have to put those patients onto dialysis. And so traditionally we would use something called hemodialysis, and that's what's shown on the top part. Oh, it's not drawing. One moment, please. That's shown on the top part of this image. And what you're doing is you're extracting blood. So you're running blood through a tube and it goes into a dialyzer. And in that dialyzer, you have an artificial membrane that is working just like that dialysis tubing that we saw on the previous page. And it's going to filter smaller molecules like glucose, amino acids, urea, ions, water from the blood. The useful materials are going to be reabsorbed and put back into the blood. The waste products like urea are going to be eliminated. So this is a way to prolong life while you're waiting for a kidney transplant, to remove impurities from the blood, waste products from the blood. So it essentially does the job of the kidneys for you. Nowadays, and in earlier stages of renal failure, a process called peritoneal dialysis is used. So in this type of dialysis, you have the peritoneum, which is in a person's abdomen, is being used as the membrane through which fluid and dissolved substances are exchanged with the blood. So we're pumping in a type of fluid, and I don't know a lot about the type of fluid, but we're pumping in a type of fluid that allows for the exchange of waste products, the absorption of waste products into the peritoneum, which can then be drained. And it has greater flexibility for the patient. This is something that you can either do in an ambulatory setting or you can do at home. What they can't do it by themselves at home. But you have a solution introduced through a permanent tube, and this does not show the permanent tube in the image. And then essentially the peritoneum is functioning as your filter, which is kind of a neat idea to use the body in a different way like that.